The other day, I was asked one of the hardest questions ever. What is congestive heart failure? This is a super common medical condition, and there are literally entire books written on this topic. So I'm going to try to explain the basics in just a couple minutes. So the key thing to remember is heart failure is literally failure of the heart to pump appropriately to meet the demands of the body. That's literally it. Remember, the job of the heart is to literally just pump blood throughout the body so that we can deliver essential nutrients like oxygen to our tissues so that they can function, and then to remove other things, byproducts of metabolism, like carbon dioxide. Causes of heart failure might include something like a myocardial infarction or a heart attack. A heart attack usually happens when you get a blockage in a coronary artery. Coronary arteries are blood vessels that supply the heart tissue with blood so that they can function properly. If the heart's own blood supply becomes blocked, then the regions of the heart that was supplied by that vessel will quite literally die. As the patient recovers, the area will usually just scar over. The only problem, though, is that this scar tissue is non-functional, so it doesn't pump normally like normal heart tissue would, leading to the heart becoming less effective. A million other things can cause heart failure too, like chronically elevated blood pressure or hypertension, genetic disorders, infections, etc. So you can imagine that if the heart is not functioning properly, it'll affect the ability of blood to be pumped downstream to perfuse certain organs, especially the kidneys, and we'll come back to why that's bad later. This can lead to damage of many different organs. On the other hand, pump failure of the heart will lead to congestion, hence congestive heart failure. The heart functions as part of a closed circuit. It pumps blood out through the aorta into our organs downstream. Then blood will return through our veins back to the right side of the heart. The heart will then pump the blood from the right ventricle into the pulmonary artery, and then that will bring the blood to the lungs so that the blood can be reoxygenated and then returned back to the left side of the heart. And then it goes down here through the left atrium into the left ventricle and then back to the aorta, and then it continues all around again. So let's say the left side of the heart isn't working properly and it begins to fail. This will lead to a backup of blood. Think of it almost like a traffic jam. And this will lead to a backup of pressure back through the pulmonary veins into the lungs. Small congested capillaries will burst, and some will become more leaky. This congestion will lead to increased pressure within the vessels of the lung. This will cause fluid buildup in the lungs and will make it difficult to breathe. Fluid backup can also continue further into the right side of the heart, and then back up into the venous circuit. This backup into the venous system can affect other organs like our liver. Unfortunately, I wasn't able to cover everything. Let me know if you want a part 2 in the comments, and thanks for watching. All right, you guys asked for it, so let's talk more about heart failure. To summarize, heart failure is failure of the heart to pump blood forward sufficiently to meet the demands of the body. Remember, the heart pumps blood in a circuit, so this is the left side of the heart, this is the right side of the heart. I know it might seem reversed, but we go from the perspective of the patient or the drawing. So this is the left and this is the right. Blood comes out through the aorta, goes to the body, then is returned back to the right side of the heart, and then goes back to the lungs to be oxygenated, and then basically returns back to the heart and goes around all over again. So if the heart is failing, you get a congestion of blood back through the venous system. It's like a traffic jam. All this blood is trying to return to the right side of the heart, but the right side of the heart isn't pumping properly or is congested, leading to this kind of traffic jam situation where we get blood building up in the venous circulation. So now let's take a look at our veins. One of the most important ones is the inferior vena cava, which remember eventually drains into the right side of the heart. This is one of the veins that becomes extremely congested and high pressure during heart failure. And one of the big organs that feeds right into the inferior vena cava is the liver. The liver is a big bloody organ, and its main job is regulating a lot of the metabolism of our body. In other words, breaking down and processing different nutrients. In fact, almost all of the nutrients we absorb from the GI tract will go into vessels that will ultimately flow through the liver for processing. So the liver is already dealing with a lot of blood, and when we add heart failure into the mix, we can see how it becomes congested very easily. Here we can see a close-up picture of a liver of someone with heart failure. Chronically elevated pressure within the hepatic sinusoids, which contain blood, cause the sinusoids to dilate and blood becomes kind of leaky, resulting in these red areas that you see all over the liver. In contrast, these more tanner areas are what the entire liver is supposed to look like. This picture here gives us a really close view on under the microscope. And as we can see, all this red stuff here, this is all blood that's just leaking out of these chronically congested hepatic sinusoids. We can see here that they're dilated and increased in size due to the pressure. Over here, all this blue stuff is staining collagen. This is from fibrosis and just scarring of the liver due to this chronic pressure-induced damage. This increased pressure and congestion of blood within the liver will quite literally cause the liver to grow and get larger as well. Remember, the liver is contained in a tough outer fibrous capsule, and stretching of the liver against this capsule due to the increase in size will actually cause chronic abdominal discomfort in people with heart failure. Blood from tons of other organs like the stomach, the spleen, the colon, all flow right through the liver, so they'll become congested as well. This leads to the gastrointestinal tract becoming swollen and edematous, causing decreased appetite and abdominal pain. That's all we have time for today. Let me know in the comments if you want to see more. Third-year medical student here, let's talk about the effect of heart failure on the kidneys. So remember, heart failure is failure of the heart to pump blood forward to meet the demands of the body. Heart failure is bad because failure of this blood pumping action will lead to decreased perfusion or blood flow to our organs. It will also lead to congestion and buildup of blood within our veins. So for instance, if the heart is not properly pumping blood to our brain, then we have decreased mental function. Heart failure patients might also have decreased urine output or decreased going to the bathroom because of impaired perfusion of their kidneys. Let's talk about kidneys. Kidneys are a true super organ, and their job, or their main job, is to regulate water and electrolyte levels within the body. Electrolytes are things like sodium, chloride, bicarbonate. When the kidneys sense that they're getting decreased blood flow, they do something to try to save the day. Now, don't worry too much about the details here, but the kidneys secrete an enzyme called renin, which converts angiotensinogen into angiotensin 1, and then ACE converts angiotensin 1 into angiotensin 2. Angiotensin 2 will cause our blood vessels to constrict and get a little bit smaller. This will actually cause our blood pressure to raise and help maintain perfusion of our organs despite the decreased cardiac output. Angiotensin 2 will actually also stimulate our thirst, with the idea there is that if we drink more water, a lot of that water will eventually move intravascularly or into the blood, and then hopefully help us increase our organ perfusion. Angiotensin 2 will also act on our adrenal glands to release another hormone called aldosterone. And aldosterone will eventually act on our kidneys and cause us to retain and reabsorb more water and more electrolytes. The whole point of all of this is basically just to put more fluid into our circulation to augment our cardiac output despite the fact that our heart isn't pumping super well. So the kidneys kind of save the day. But this ends up being kind of a double-edged sword. This increased fluid retention can actually worsen pulmonary congestion that's already happening in the lungs due to heart failure. Normal arterial pressure in the lungs is maybe around 8 to 20 millimeters of mercury, but then once you retain more fluid and more volume, then that pressure starts to climb up. And then once you start getting above 20 millimeters of mercury, then you can start getting pulmonary arterial hypertension. This increased pressure will cause fluid to basically just ooze out of the vessels into the lung parenchyma, making it hard to breathe. Furthermore, this increased intravascular fluid will also increase the load that the heart must pump against. And in an already failing heart, this might serve to further impair cardiac output. So the kidneys can actually help heart failure in the short term, but in the long term, they can sometimes worsen it. That's just a brief summary of heart failure in the kidneys. There's so much more to talk about. Let me know in the comments what you'd like to see next. Thanks for watching.